Dr. Mark Britnell, you spent the past 3 decades searching for the perfect healthcare system. How close did you come to finding it?
Well, over the last 30 years or so, I've worked in 60 countries. I've circumnavigated the planet 70 times over. And I'm sorry to say that there is no such thing as a perfect health system, but there are fantastic examples of great health and healthcare all over the world. And my book is written to show that every country has something to teach and every country has something to learn.
And if we could only put it all together, for example, you say that Israel has the best primary care, Japan has the best elder care, and the US has the best R&D. Can you expand on that? Why is our R&D so good?
Well, first of all, your research and development commitment and expenditure is greater than that of the combined European Union. You produce more Nobel Prize winners in life sciences, pharmaceuticals and medical devices than any other country. And the drugs that you produce and distribute help billions of people all over the planet. Of course, American citizens pay for that privilege, and I know that we'll come on to that debate later on. In terms of Israel and Japan, Israel is a highly tech-savvy nation. It's developed good community care, good family care, good primary care. It only spends 7.3% of its GDP on healthcare, and its citizens live on average to 83 years of age. Japan, of course, the oldest population on the planet, average life expectancy of 85 years of age, 10% of their GDP spent on it. Back in 2002, their politicians had a massive debate with their people about how they could afford to provide dignified care to their aging population, and they placed an extra tax on everyone over the age of 40. It wasn't popular at the time, but it has worked. So I do single out Japan, also Israel and the United States.
Let's come back to the US and R&D, because in the presidential debates, we've been hearing a lot about drug pricing. It's also hit Wall Street. So if the government gets too involved in pushing down or controlling drug prices, will that hurt our R&D?
Well, first of all, you are spending perhaps 2, if not 3 times more for your drugs than many other developed nations. I think in terms of your research and development platform, we need to pursue a platform and program of sustainable profitability. I think super profits will cause governments to react and abreact. Certainly in Europe now, most governments are suppressing drug costs because of the issues around healthcare affordability. Of course, life science firms need to make a decent profit to reinvest in research and development. So I think both parties have to get together and talk about the future so we have sustainable profits, but also affordable drugs as well.
Well, speaking of spending, the US spends 17% of its GDP on healthcare. Are we getting our money's worth?
Quite frankly, no, you're not. You know that you spend more than any other country in the world. Your life expectancy is still 2 years less than the OECD average. You can get a lot more out of your health system. In my book, In Search of the Perfect Health System, we estimate that something like $800 billion worth of waste is embedded in your health system. So you can do a lot more for a lot less.
Well, we've been hearing a lot about Obamacare. Within those presidential debates, what's your stance? Are you for or against the Affordable Care Act?
Well, I'm for universal health care. As you know now, with the Sustainable Development Goals, all countries in the world have had to sign up to universal health care by the year 2030. America is the only developed country in the OECD that doesn't have universal health care, so I'm for universal health care. I think the costs and the benefits associated with Obamacare, it's still a little early to say whether they're all working. Pleasingly, 17 million more people have got access to health care, but you can still do a lot more driving costs down and access up. So I think the work has started, but it's certainly not complete. I wouldn't ditch it all. I think these opportunities come politically once in a generation. I listened to the debates last night as I flew in from London. Clearly there's a lot being talked about, but I think the political phase of whether Obamacare stands or falls, I think is largely gone. It's now making sure it works, because even if it was to be replaced with something else, the issues are just the same. Better population health, better patient care at affordable costs and prices for the average American citizen.
And then finally, we are here on Wall Street, and we're always looking for the next best drug company, the next best drug stock. So from what you see, looking out to the future, is it oncology? Is it immunotherapy? If you were going to invest, where would it be?
Well, I do talk in my last chapter about things to bet on. I would bet on retail pharmacies. I think they've got a big future. I think personalised medicine is also, I think, going to be terribly exciting. Of course, you lead the way in that. Certainly, when I was in Davos last year, there was talk about precision medicine. Once the genetics gets under $2,000 per test, then I think you're going to see the rapid advance of testing. And of course, individualised or personalised medicine may unlock your code, which in turn means that prevention and treatment should be, in theory at least, more affordable and more precise.
All right. Thanks a lot for coming on and talking about your book.
Thank you.
And thank you for watching The Street.